Hello, my name is MJ with Colorado Promotions. Today I'm here with Dr. Steve Parcell, who's here to tell us a little bit about low testosterone. Dr. Steve, why don't you tell us a little bit about yourself?
Thanks. I'm a naturopathic doctor and have been practicing for 9 years. And I'm also the co-owner of NatureMed Clinic here in Boulder, Colorado. And I've been had extra training in anti-aging medicine through the American Academy for Anti-Aging Medicine, and I'm even board certified through them. And essentially what happens in that process is you learn everything that's involved in the aging process, and there's a special focus on things like hormone replacement and hormone optimization. So I've done extensive training through them, and we've been engaged in balancing hormones now for probably about 7 years, pretty aggressively. So it's a specialty of mine.
What are some of the common causes of low testosterone?
Yeah, low T or low testosterone is getting promoted now on TV, on some ads, and as the population ages, we're discovering that we can help the aging male age better by replacing testosterone if it becomes low. So it's actually giving something that's more and more common. Even 10 years ago, especially 20 years ago, it was virtually unheard of. Only bodybuilders would take it. Now, general practitioners are even prescribing it to some of their patients. What I would say is some of my concerns for patients is that most doctors don't have special training in the management of testosterone replacement therapy, and I've seen quite a bit of this. They might just check a total level and replace it and not do any follow-up testing, and they'll underdose or overdose. I've seen it all happen. So you got to get the dose right, which means you actually have to do follow-up blood testing, and then you want to make sure there's no adverse effects. Okay, very important for patients. They're like, well, what's the downside? What's the risk? So let's talk about that now. The only real risk. Well, there are a couple of risks, but the biggest one would be if a patient had prostate cancer, it could encourage it to grow, but it does not cause prostate cancer. There's a couple other things that can happen too. In certain patients, their good cholesterol can go down, and their blood pressure may go up, their blood volume can go up, and their red blood cell count can go up, especially here in Colorado. And that's really it. I never see liver problems. Some other things two important things. There's two hormones that can go haywire. And one is estrogen, can go up, and the other one is DHT, which is dihydrotestosterone. And it's made from testosterone. It causes male pattern hair loss and can also make the prostate swell. So these are very important issues that I have never seen other doctors running DHT, but when I do see it, which is occasionally, from someone who's had extra training, by seeing it, I know they've had extra training. So you want to make sure that you first do no harm, and then there's an ad now called "Is it low T?" and you can do the ADAM questionnaire. It's an ADAM. If you Google it, questionnaire, and it screens for some of the symptoms associated with low testosterone to help doctors determine if they should even bother to run a blood test. Okay. I think that's great to do. Definitely anyone who's watching this video should do it. I like to test all men over age 40 every year, just at baseline, just to kind of see where they're headed. Is it low T? Well, if the free or total testosterone, so free or total, is low on a lab, well, it's low, okay, period. And you can retest it. Maybe it was a bad day. I find that very rare. Maybe once or twice a year has something haywire going on, and they don't really have it. It's not really low. What you'll never see, though, is if it's low on the lab, it's not going to be really in the high upper range the next time it's tested. The person is running a generally low level, and so I don't test people 3 times. A very low level should be followed up. I'll do 2 tests. or if they have a history of this and they have other tests, then it's low. So there's a normal level for your age. The reference range is really wide. It's depending on the lab, it's 240 to 1100 or 800, really wide. So what that means is that you can have a 75-year-old patient with a level of 450, okay, and you could have a 40-year-old patient with a level of 350, and they're both normal. And this is why, it's why you have to know what you're doing. You have to understand the reference range. So if you're 40 and your level's 350, that's not okay. And that should be checked again. Some of the symptoms include, so it's actually a health risk. Running a low testosterone level puts the patient at risk. Decreased bone density, increased risk for calcified arterial plaque, increased triglycerides and cholesterol, increased abdominal fat, decreased mood and decreased sex drive, erectile dysfunction, depression. There's nothing good about having a low level. And the older you are, the more important it is to have a good level. They did a study recently, and it was called Higher Testosterone Levels in Elderly Men Predicts Lower Risk of Heart Attack. So this is a big deal, and it's not the only study. There's a good 8 or 10 studies on this type of thing. So if it's low, it's a medical condition. If it's low normal and you're middle-aged, low normal meaning you're just above the reference range. You're 300 through 50, which wouldn't technically be low. But you have symptoms like erectile dysfunction and low libido, inability to gain muscle, depression. A therapeutic trial could be indicated to see if there's improvement. There's no risk to that. You try it for 3 months, and if there's no improvement, you can go off and you will return to baseline. Everyone's a little different. There's some other things that are involved too. One is vitamin D. Vitamin D is actually a pro-hormone, and it's involved in testosterone's binding to the testosterone receptor, and also estrogen involved. Estrogen is a competitor to the receptor for testosterone. So, in other words, you could be 45 years old, have a testosterone of 360, and if your estrogen is 65, in effect, you're functionally low. You functionally have hypogonadism because you're getting that competitive binding at the receptor site. Let's see, risks. Let's talk about risks. So I talked about the benefits. The risks, I think did we talk about that? I think we've talked about all the risks in the follow-up. DHT, estradiol, which is estrogen, bone density. So that I think that pretty much covers it. So the important thing for a patient to know is that family doctors typically they're not comfortable prescribing testosterone. An endocrinologist will typically only want to treat a patient if its levels are very low. They have to be low, completely low all the time. And urologists sometimes do it, and that's fine as well. But you gotta, I believe that patients need follow-up labs to determine that the dose is optimal and that there's no harm being caused. And I can't tell you how many times I've seen no follow-up lab testing. It's a year later, someone was on a gel and their level's 340. It's just, it's not that hard to do, quite frankly. Patients are also very interested in the different forms of testosterone, so maybe I can talk about that. There are gels and creams. There are buccal troches. It's basically it's like it can be a film that you stick on the roof of your mouth or underneath your tongue. There is a bioidentical oral one now available it's sublingual. There are pellets that can be inserted under the skin, and there are shots. And then there is of course also the patch. There's a patch, an androderm patch people can put on, and I just discuss these with patients. So just to kind of recap, we're an integrated clinic. medical doctors, naturopathic doctors, and we're an evidence-based medical clinic. And we really provide very personalized services without any extra fees. And we have specialties in hormones, my specialties in particular, hormones and preventive cardiology. We also have a subspecialty in integrative oncology here.
Okay, great, thank you. For more information about Dr. Steve Parcell and Nature Med Clinic, you can visit naturemedclinic.com. Thank you.